Hey, Dr. C with you. So taking thyroid medication is not the same thing as having a healthy thyroid. And I want to talk a bit more about that. So this is not intuitive, but there's a great deal of understanding that low thyroid function causes problems. No debate about that. It can make weight gain easier, can cause fatigue, cause hair loss, irregular menstrual cycles, infertility, digestive problems, lots and lots of issues. And because that's true, it's easy to think that medications would solve those problems. We also know, for example, that thyroid function can cause changes in mortality risk or changes in cardiovascular risk. And you would think that then medication could solve those issues. But I want to make a distinction between taking a hormone and making a hormone, because it turns out they're not identical. So what happens is that when your body makes it, it's because it's doing it on purpose, and these hormones are being used in a big variety of ways. When you're taking a hormone, it can be necessary, it can be life-saving, it can be very important, but all too often, it doesn't equate to the exact same thing your body would do. And in some cases, we have some guesses as to why. In other cases, we're not clear on, but it does seem to be different. So this has been studied the most with a condition called subclinical hypothyroidism. And that's one where the thyroid is being yelled at, there's a higher TSH, but it's still making hormone, so it's not yet shut off. And we know that people that have this have a lot of health problems, and they often have symptoms. But the data has gotten really strong that giving medications do not lower the risk and do not usually improve the symptoms. So what we're seeing is this difference between taking hormone and making hormone. They're not quite identical. In the case of this subclinical disease, there have been large studies looking at huge numbers of people, hundreds of thousands of people, and they've shown that, yes, with abnormal thyroid levels, there's a lower quality of life. People don't feel well. We do see that they're more fatigued. They often have symptoms of depression, that their cognitive function can change, their overall disease risks can change, their mortality risks are higher. But yet, when we take these same people and look at the medicated groups, those problems are identical. So even though the medicated groups now have normal, even sometimes optimal thyroid levels, they don't have the same outcomes. And this is a critical distinction is what we expect would happen, we can't say for sure it happens until we see that it happens. So even though we know abnormal thyroid levels can cause those problems, we would predict that changing those levels would change those problems. But the one doesn't necessarily follow the other. And this is important because subclinical disease is the most common reason people are put on thyroid medication. Overt hypothyroidism is where the TSH is up, like greater than 20, and the T4 has dropped off, like way below range. In those cases, these concerns don't apply in the same way. And then there's also those who lack a thyroid. It was taken out or it was ablated. And in those cases, again, these concerns don't apply in the same ways. But for those that had an elevated TSH, and this gets even deeper because there's so many people that are on medication that never even had an elevated TSH. This has been called suboptimal thyroid function. And I would argue that those who were patients of natural practitioners, the majority of them were in this range. They weren't even at subclinical disease. So whatever we can infer about subclinical disease is only more pronounced in those with suboptimal disease. So the thyroid really can cause problems, but that doesn't mean medication solves those problems. One more piece of evidence about this was a large study that was done recently looking at people who were on treatment for thyroid disease and comparing those against people that were not on treatment and healthy controls. And this was pretty big. This was 500,000 people who were on treatment compared to about 1,500 people who were not. And they matched these groups up really precisely, pretty much the same proportions of males and females, very similar ages, and also the very same risks for other problems. So what I mean by that is, about 20 to 19% in each group had high blood pressure. The rates of diabetes were about the same. The rates of prior heart attacks were about the same. So anything else that should have caused problems was not radically different between these two groups. Yet the rate of early mortality was anywhere between 1.3 to 2 times higher in those on medication. So what your body does by its own, we can't replace the same way with medicine only. It's critical to have your body do as much as it can. Now, this is not saying medications are harmful. It's not so much that medications were causing side effects. It's more so that there was a lack of benefit from one's own output. So even if you're on medication, the more your body can make by itself, the better. And this is true both in terms of these longer-term outcomes and disease risks, but it's also very true in terms of quality of life and symptoms. And this is why so many people are on medication and they struggle to resolve their symptoms. And it seems like the next change in medicine or the next change in dosage, that's the one that's going to do it. But all too often, it's a fool's errand, and that promise never really materializes. And now we know that this is why, that taking it is not the same as making it. Now, here's the good news. The likelihood of your thyroid making more hormone again is very high. The studies have shown now that about 80 to 90% of people can see more output from their thyroid. And of them, somewhere between 40 to 50% can reach a point where they don't need any thyroid hormone any longer. And even those who do need thyroid hormone longer term, they can take steps to work with it more effectively. These are the main things that change this are regulating iodine. This is the biggest known single factor. So the Thyroid Reset Diet is a guidebook that shows you how to do that. And it was based on these very studies that I'm talking about. They showed that the disease can reverse for most people, that most can lower their requirement for medication, that many can end up needing no medication. So it's very good news. But yeah, the message is that whatever your body can do by itself, it's always better than what we can do on the outside. You know, our internal capacity for control and regulation is amazing and it's powerful, and we can't totally replicate that. All right, Dr. C with you. Take good care. We'll talk again really soon.